Thank you very much for trying. It's Grace Chemaine.
Oh, thank you.
It's French. My name is Grace Chemaine. I'm speaking on the behalf of the League of Women Voters of Texas. I'm a pediatric nurse practitioner and a nurse and a volunteer. We appreciate the opportunity to provide comments on HB 308 and appreciate the opportunity to speak to you today. The League of Women Voters of Texas opposes the Guns Everywhere bill, and we believe that proliferation of handguns and semi-automatic assault weapons is a major health and safety threat to its citizens. We believe government should play an active role in preventing violent behavior, and we support regulating firearms for safety. The state of Texas motto is friendship, not hands up. We implore the legislature to keep Texas as a family-friendly state. This law takes away from the joy and safety most Texans take for granted at family-friendly events. Children and families should be able to enjoy amusement parks, sporting events without the added danger of guns. The more guns in a community, the more violence by guns and the more gun injuries that occur. They should also be able to worship without concern for who is packing. Patients, their families, employees at hospitals should be safe from guns at hospitals, emergency rooms, and nursing homes. I don't know any nurse or doctor who wants to have guns in their emergency room. Often hospitals are a place of chaos, stress, and grieving. Don't add guns to the mix. Finally, Texas should be able to go out for a nice cold beer without having the added danger of firearms in their bar. Legislation in Texas, such as the Stand Your Ground law, has already increased justifiable homicides. The Texas A&M study found in 2012 the Stand Your Ground law was associated with a 7 to 9% increase in the total homicides. The cost and data of health care for 3,546 gun trauma victims reported to the Texas EMS trauma registries in 2013. Those gun traumas cost $200 million to treat from those firearm injuries. The more guns in a community, the more injuries by guns. Guns are the second highest cause of emergency medical service injury trauma runs called dead at the scene runs in 2013. The League of Women Voters calls on the 84th Texas Legislature to take in consideration the effect of Guns Everywhere law has on gun proliferation, the cost of health care for victims of gun violence, the cost for public safety, the cost to family, and victims of gun violence. Thank you.
Thank you very much. Before you leave,
Yes,
I
sir.
want to clarify your position on the bill.
Against.
Against.
Thank
And Representative White has a
Yeah, I
question.
just
believe.
had some questions, and I'm sorry I was out for a while. So,
Okay.
but where's the statistics of violent crimes being committed by concealed handgun?
I'm not talking about
licensed?
violent crimes. I'm talking about firearm injuries.
Okay, and what was the statistics again?
The one violent crime was the 7 to 9% increase in total homicides, and I have it.
Against that's involving concealed handgun
No.
licensed owners.
No, it says
Okay.
Texas A&M University study found in 2012 that the Stand Your Ground law was associated with a 7 to 9% increase in total homicides. And I have it right here if you would like it. I have copies.
Okay.
And most of the other data I provided is about firearm injuries, because the more guns you have in a community, the more trauma and injuries you have from those guns.
Well, I'm not so positive about that research or those results, but
If you like, you can provide that information
what
to the.
I'm concerned
committee.
about though is why we would oppose someone's right to carry. I mean, I know you have your feelings about it, but I guess I'm thinking, how much of our constitutional rights are we willing to give up before we don't have any rights at all? Because people are fearful or they just don't like it.
Well, what I'm looking at is the data for firearm injuries and how many accidental, purposeful firearm injuries happen because of gun violence. And I do think it's a really important area to look into. When I'm hearing people speak, I hear them always talking about crime, and I understand that. But as a nurse, I think about children's safety, the safety of domestic violence, the women in the family. I think about the injuries that occur and are being treated at
That's
hospitals.
fine. And people get injured for all kinds of things. So
Yeah.
if we have to regulate everything to try to keep people from getting injured or self-inflicting injuries. I mean, we can only, regulations cannot keep people from getting hurt or hurting
No,
themselves.
actually,
Sorry, I just want to interrupt you guys. We would like
Anyway.
to keep this limited
okay,
to the
thank you.
bill if we
Thank you.
could.
No,
It's
That's
getting a
true,
little too
but
general.
I was just concerned about reasons why to keep people from having their constitutional rights. Thank you.
okay, thank you.
Thank you very much.